Hi, I'm Lisa Squires, Senior Communications Advisor for Alberta Health Services, and this is Health Matters. Joining me today is Aaron Liddell, and Aaron is an exercise specialist with the Alberta Healthy Living Program. And today we're going to be talking about exercise and how important it is for our hearts. So welcome, Aaron.
Thank you.
So I understand that February is Heart Month. So why is exercise so important for our hearts?
So exercise has a number of benefits as far as our heart's concerned. Your heart is a muscle, and so exercising helps strengthen the muscle of your heart so that it pumps blood more efficiently. Exercise also helps to reduce levels of cholesterol, so it helps keep your arteries clean and flowing nicely through your heart. And exercise also helps to increase the oxidative capacity of our muscles, so your muscles are better able to extract and utilize oxygen from your bloodstream so that your heart doesn't have to work as hard.
And if somebody hasn't exercised in a while, how can they get started?
First thing to do is if you're ever unsure if you're safe to be exercising, it's always a good idea to consult with your doctor first. You can discuss with your physician if you have any special considerations you might need to make before you start an exercise program. Second thing to do, it's always a good idea to speak with an exercise specialist, someone like myself, or maybe at your local fitness facility, they have a trainer. If you're doing something like that, it's a good idea to check with their credentials first, so don't be scared to ask questions if you have any concerns at that point. And then thirdly is to start slow. You know, Rome wasn't built in a day, and just because someone might not be running a 5K the first time they get up and exercise doesn't mean that they're not still getting the benefits out of exercise from it. So no matter how slow you're going, you're still lapping everybody that's on the couch.
And what does a heart-healthy exercise plan look like? What should people be doing?
So the Canadian Society for Exercise Physiology, Health Canada, and the Canadian Heart and Stroke Foundation all recommend that adults try to achieve about 150 minutes of moderate to vigorous physical activity per week. So that can be kind of broken up and adjusted into smaller increments to fit individual needs, and as little as 10-minute bouts at a time are considered to be effective. So maybe you've got a busy day at work and can't squeeze in an hour-long workout. As little as 10 minutes on your lunch hour can be enough to start getting some of those health benefits out of the activity that you're performing. You want to focus mostly on aerobic or cardio type exercises first and foremost. Those are things where, like you're running, walking, swimming, things that are going to get your heart rate up, get your breathing a little bit heavier, because those are going to give you kind of the most bang for your buck in terms of heart and overall general health. A really well-rounded routine should have some aspect of strength training or resistance training in it. You don't need to do that as frequently, and about 2 to 3 days a week is generally enough for most individuals. Similarly, you want to focus on big muscle group exercises when planning an appropriate exercise strength training routine. Things like pushing and pulling movements, squatting movements, because again, you get the most bang for your buck. And you generally want to stick with higher repetition, lower to more moderate weights to start with, about 12 to 15 in the repetition range. And then finally, a totally well-rounded routine should have some aspect of flexibility or stretching type activity. Generally about 2 to 4 days a week is what we recommend for individuals, and you can perform it after your regular exercise routine, just to help keep your muscles and joints loose and limber, and it's going to help prevent injuries as well.
And is there anything else that you'd like people out there to know?
Most importantly, exercise only works if you do it. It's far more important to choose an exercise because you enjoy performing it rather than based on what someone might have told you or what you might have seen on TV or something like that. You know, we're far more likely to begin and continue with an exercise program long term if we pick something that we like doing and rather than something that we've been told to do. So, you know, play sports, go for a walk with friends, join an exercise group with a workout buddy or something like that. Because that way you'll not only get the health benefits out of exercise, you'll have a lot more fun while you're doing it too.
Great, thanks, Aaron. Those are great tips, and thanks to all of you for watching. I'm Lisa Squires, and this is Health Matters.